For more, I want to bring in Dr. Stanley Perlman. He is a professor of microbiology and immunology and a pediatric infectious disease physician at the University of Iowa. Doctor, we already saw a dangerous spike in cases after Thanksgiving holiday travel when we understand that fewer people actually left their homes. What are the next few weeks going to look like in hospitals across the nation and right there in Iowa?
Yeah, so I think that what we just heard was really symptomatic of what's going to happen. There's probably, or almost certainly going to be a surge of cases. And with the surge of cases, more people who are susceptible to severe disease are going to be infected, and hospitals everywhere will have more cases. So far in Iowa, my understanding is we haven't been overwhelmed. But I worry about the next 2 or 3 weeks after people return from winter breaks.
How big of a blow do you think that this new COVID-19 strain will be to the fight against the coronavirus in the United States? And how quickly do you expect it to spread across the country, given that the early analysis is that it is, in fact, more contagious, though not necessarily more lethal?
Yeah, that's exactly what we understand right now. So that if you have two people are infected with these viruses, two different people, that the person who's infected with the new variant will be able to infect more people if everything else is the same. And the key thing is everything else doesn't have to be the same, because human interactions and human behavior really influence how the virus spreads. So if somebody's taking the appropriate precautions, even with the more virulent or more transmissible strain, they will be protected from spreading it to other people. If everything else is exactly the same, we think this strain spreads more readily. But it's a lot is done by modeling, and we don't have all the answers by any means.
Well, as I mentioned in the introduction, vaccinations are happening much more slowly than the government anticipated, indeed, than all of us hoped. Doctor, what needs to be done in order to get more Americans vaccinated more quickly?
Well, I think the obvious things you have to have, the vaccines have to get to where they're needed more quickly. They have to be there has to be healthcare workers to deliver the vaccines when they're there. And the last thing that was mentioned is people have to be aware that taking the vaccine is the best way to really end this pandemic. So those are the three things that need to occur. I think that as we see that the vaccine works and that there's really very minimal side effects except for the local effects of getting the vaccine itself that day of and the day after, that people will be more interested in obtaining the vaccine. This is a bad disease. We're still having what are we up to now? 1 in 1,000 people in the U.S. has now been killed by this virus.
Well, you mentioned earlier the modeling and the efforts that go into modeling and how it tries its best to make predictions. Many experts are saying, based off of these models, that the U.S. is about to enter the worst phase of the pandemic so far. In fact, one model actually predicts that we could see 150,000 coronavirus-related deaths in the next month. Do you agree with this prediction? And if so, why is the country in a worse place than it was early on in the pandemic? Now that we have so many more tools in our tool belt, I think it's really frustrating that we are looking at things becoming worse rather than better.
Yeah, I couldn't agree with you more, because we still know that the way you deal with this infection is you protect others from being infected. If you're infected, you protect yourself by wearing masks, social distancing, washing hands, doing all the very simple things that can prevent spread. And when you have gatherings, we know that if you're in a gathering that's enclosed, it's in a closed area with not such great ventilation, such might as occur with several people getting together over Christmas break or over Thanksgiving break. We know the virus likes to spread in those conditions. So we know what we need to do. And if you have a virus that's a little more transmissible, it's just going to make things worse. But even though the models say that the virus matters a lot, I think what matters a lot is human behavior. If people really pay attention to the behavior and do what they can to minimize transmission, that would be the best way to prevent this surge that we all worry about, the surge on the surge, as you called it.
And the other part of that question, do you expect that those models are in fact accurate, that we could be looking at 150,000 coronavirus-related deaths in just the next month?
Well, models always depend on the assumptions of the model. So it's assuming we assume that certain things are going to be done. A certain number of people will be vaccinated or not vaccinated. Certain numbers of people will or will not obey the rules for preventing infection. So they're just models. And certainly when we see a model like that, we had predictions for the number of deaths that would occur by the end of the last year, and they became pretty close to being accurate. The worst case scenario was 400,000, and we're almost up there now. So yes, we have to pay attention to the models, but models are not perfect, and they can be modified by our doing the right things.
All right, Dr. Stanley Perlman, thank you.
You're welcome.